Well, hello and welcome to another edition of Health Solutions with Shawn and Janet Needham, where Team Needham discusses everything healthcare. I'm your host, Shawn Needham, and I am streaming live from Idaho Falls, Idaho. And we had our first snow. So weather is definitely changing. I love the change of seasons. And today I'm super excited to have Dr. Paul Marik back on our podcast. If you remember back a few months ago, I was actually in Idaho Falls when we did that podcast. We had him and Dr. Apter and Dr. Bowden on our show talking about their lawsuit against the FDA when it comes to doctors and making choices for their patients and the FDA getting involved. So check that episode out. It's on our YouTube channel, the Mosley Professional Pharmacy YouTube channel. And today, what we're going to talk about with Dr. Marik, during that discussion, that last podcast, we were discussing his health journey and how he was able to, lose weight, get healthy, and get off a lot of his medications. And at our, if you follow Health Solutions at all, we talk about that a lot. I mean, Janet and I are two pharmacists that don't believe in most medications to treat most long-term disease. Most of these diseases are lifestyle related, whether it's type 2 diabetes, whether it's high blood pressure, whether it's high cholesterol. If you change your lifestyle, you can get off those medications. So without further ado, Dr. Marik, welcome to our show.
Thanks. Thank you for having me back. It's a pleasure.
Yeah. Thank you so much for taking the time. I know that you're very busy. You've been to 3 conferences over the last 3 weeks, and you are the leader of the FLCCC. And I thank you for doing that. I know that you have a lot of arrows on your back, and you have been, just beat up a lot over that. And in reality, you fought for a lot of patients. And so thank you for doing that.
Sure. Yeah.
So tell us a little bit about your health journey. How did it start? What kind of, disease states and medications did you go on? And then how did you get off of them?
Yeah, so it's difficult to know where to start, but basically what I learned is everything I was taught at medical school was a lie and was not true. And so what I've had to do is unlearn whatever I learned at medical school. The approach of medical school is to treat symptoms with drugs rather than to treat diseases and to cure diseases. That they want you to be dependent on medications for the rest of your life. And I suppose this journey for me personally started off when I began looking at interventions for the treatment of the vaccine injured. I suppose that's really what triggered this personal journey for me. And, I came across the idea of intermittent fasting. I read the book by Jason Fung and realized really how potent an intervention this really is. And then I started reading about, metabolomics. There's an excellent book by Robert Lustig called Metabolomics. And then I read the book by Tim Noakes, who was basically put on trial for suggesting that a low-carb, high-fat diet had health benefits. And so, I realized that much of what we've been taught is a lie, just the same way as big pharma and industry controls medical schools and big pharma. So does, the food industry and the big food consortiums control what we eat, how we eat. And the USDA food pyramid is a complete fabrication. It's false and is completely upside down. So my story was I've been a type 2 diabetic for maybe over 25 years. I've had hypertension. I was on a PPI for reflux. And obviously I thought I was committed to be a diabetic forever and to take those medications forever. And that's obviously a big lie because type 2 diabetes is a treatable disease. It's caused by insulin resistance, which is really caused by our lifestyle. And it's likely that sugar and carbohydrates kill more people in this country than smoking ever did. It's a profound toxin. And, obviously, most people do not eat food, real food. They eat processed food, which is not food. It's highly processed, high in carbohydrates, and high in processed vegetable oils. And this whole thing is a complete and utter scam and a lie. Then there's the cholesterol statin lie. So, we're told saturated fats are bad. Actually, saturated fats are quite good for you. What's bad for you is carbohydrates. So it's a complete opposite of what we're told. So whenever something is, low fat, that means it's high in carb, and that's the last thing you ever want to eat. So basically what I did, it was pretty simple. I tried to lose weight before, but the traditional way of dieting, which is exercise more, eat less, just simply doesn't work because it's not based on human physiology. And the whole concept is profoundly flawed. And that's why almost 90% of people who try lose weight by this mechanism within, 6 to 12 months will regress back to the mean and where they started. So I tried and failed. And, all I did was really two simple interventions. I started intermittent fasting because that's the way the body is designed. We're not designed to eat all the time. And at the beginning, it was a little bit difficult, but like most things in life, the more you do it, the better you get. And with practice, you get really good at doing it. So I had an eating window of about 4 to 6 hours, from 12 to 6. And then with time, I was able to narrow that window to the point now where I eat once a day. And the remarkable thing is I don't get hungry. And the problem is with insulin resistance, it creates this vicious cycle where you're insulin resistant, which blocks the effect of leptin on your brain, makes you hungry. If you're hungry, you eat more carbs and more sugar, which causes more insulin resistance. So it becomes a vicious cycle. As soon as you break the cycle, you lose your appetite. So, I can go actually 36, 48 hours without eating and not be hungry. So it has to do with breaking insulin resistance and also the effect of ketosis. So I did two simple things. As I said, I did intermittent fasting, and then I changed my diet from processed food to real food. And it's quite simple to tell the difference. If it looks like food, it's likely food. If it comes in a box or has a label or is processed in a bag, it's not real food. So I already did those two things. And within 6 weeks, actually, I was off all my diabetic medication. I'd stopped my PPI. I had stopped my blood pressure meds. So, I had been condemned to a life of type 2 diabetes and medication forever. And just by changing my lifestyle, I was able to reverse my type 2 diabetes, hypertension. I lost 40 pounds, by the way, and I did that really without even trying. So this is not a difficult journey. It's just common sense. It's the way the body was designed. We've been fooled by big pharma, by big food, by our agencies, by the federal government into this myth. And so, people need to empower themselves. They need to take control of their life, the way they eat, how they eat, where they eat, and to realize that the agencies and the government are not interested in promoting health and well-being. That's not what they're interested in. They're interested in making money through selling you expensive drugs for which you're addicted to for life, and selling you unhealthy foods that just perpetuate the problem. So, these competing cycles. And that's the unfortunate story. At medical school, they don't teach you lifestyle changes which promote health. They basically focus on symptomatic treatment of disease with medication. And it's a really sad story.
It is. It really is. And I would tell you, Dr. Marik, thank you for that. In the last 10 minutes, you basically just summed up the last 3 years of our podcast. Because we've been preaching this for a long time, and even before we started the podcast, my wife and I are, we're two pharmacists that don't believe in medications to treat long-term disease. I mean, that's very powerful, and we have tried to tell people that yes, type 2 diabetes, it's reversible. There's no reason you have to be on medications. And one of the best ways to, you know, show that you can reverse type 2 diabetes is through fasting. I know one of my, the doctor that I work with, one of the things that he does with his type 2 diabetics, he's very careful with them if they're on medications that can cause hypoglycemia. But he says, if you want to see if you can reverse your type 2 diabetes, just fast for 48 hours. Fast for 48 hours and see what happens to your blood glucose. It goes down. I mean, it's that easy. So that proves it right there. That's an easy one to prove that it's reversible. And you said it. One of the goals of our podcast is to educate and empower individuals to take charge of their own health. If there's anything we can get out of the last 3 years, that's what's happened in our healthcare system is we have to be in charge of our own health. We can't trust any government agency. We can't trust anybody but ourselves to take care of our health. And we can use healthcare professionals to help educate us, but ultimately we are in charge of our own health. What we put in our mouth, the drugs we have to take or don't have to take, that is ultimately up to us. So, thank you for being a role model. That's one of the problems I think that we have in healthcare is a lot of the doctors aren't good role models when it comes to, fixing health instead of just treating symptoms.
Yeah. So big brother's not looking after you. You have to take control yourself. And, there's a lot people can do. I think first is knowledge. Knowledge is power. And if you understand what's going on and educate yourself, then you can make decisions that are rational and that are based on improving your own health and lifestyle and quality of life. Because these agencies are corrupt. There's no question of doubt that they are corrupt, they're fraudulent, and what they have done is a crime. But that's the way they operate. And so you have to realize that these agencies and the federal government and all these, the medical schools are controlled. The NIH controls the medical schools. They control the curriculum. They control research. The medical journals are completely captured. The medical journals are captured by industry and the drug industry and big pharma. So, you have, there's this awakening, this enlightenment. And with that comes, lifestyle changes, which can empower you. Just going for a walk outdoors, getting sunshine. Sunshine has such enormous curative powers. Who would have thought about this? And there's really good data just that being in the sun. So, in fact, in the 1918 influenza pandemic, there was something called the open air approach. And basically, they took people from the hospital beds, put them in the sunshine. And there was a really very interesting report by the Surgeon General of Massachusetts written in 1918. And basically, by just putting people in the sun, they reduced the hospital mortality from something like 40% to 12%, just by putting people in the sun. So, there's some very, what's more natural than that? Nobody can charge you. They can't make money out of this.
Right.
There's no way that they can capture you. They can't stop you exposing yourself to sun. And so you can see that there's simple interventions that you can do that can enhance your health.
Well, and you kind of hit on it early on when you were talking earlier when you're talking about our bodies weren't designed to eat all the time. I mean, if you think about what we did, 1,000 years ago, we didn't have, 24/7 access to food, which most Americans now, I mean, when we get home, our pantry and our freezers are full of, and fridges are full of food. We have basically an unlimited food source. Well, 1,000 years ago, you talk about fasting for 36 to 48 hours. That's what hunters and gatherers did. I mean, you would go on a big hunt, you would eat, you would have something, you would eat fat, you would, feast, and then you wouldn't have food possibly besides maybe a little bit of stuff from gathering, like some plants or something, berries or whatever. But you wouldn't have a big meal for another 48 hours when you had another hunt. So our bodies were designed to fast regularly, and that's one of the reasons we store fat so well. Is it's an energy source, and if we have too much food we store too much fat. So our bodies are incredibly resilient when it comes to being able to fast and built that way.
Yeah, and the other thing is the human body has enormous powers of self-healing and self-generation and self-curing. And, it's been quite clear with COVID and the consequences of the vaccine that what one really needs to do is enhance and potentiate the ability of the body and the host to cure themselves. There are these, very important cellular and host mechanisms that are self-healing. So rather than taking medications, what you need to do is, stimulate or activate these processes of self-healing. It sounds absurd, but that's what the body does. As you said, we were hunters and gatherers, and we didn't spend all that time indoors under fluorescent lights. We were outdoors hunting and gathering and doing whatever we do. Now, particularly with all these stupid lockdowns, kids are, imprisoned indoors. They don't see sun. They don't get any exercise. And, that's not the way we were made.
No, and when you look at, um, what we did thousands of years ago, to be outside and to hunt and gather and to fast. And when you look at also the sleep routine, we're diurnal creatures. We were created to work during the day, hunt, gather, and sleep at night. And when you talk about the body, responds and the body recovers, we need to do that when we sleep, and that's when we get stronger. That's when our immune systems get stronger, and we've been fighting viruses like that, viruses and bacteria and all kinds of other things, cancers, for thousands and thousands of years. And it's really not until the last 50 or 70 years where autoimmune diseases and other things have popped up, partly because of our lifestyle, our lack of sleep, our poor diets, all that stuff. Our bodies were not designed to be treated like that.
Yeah, I mean, what you say about sleep is so important. I mean, sleep is a time for the body to recover, most importantly, for the brain to recover. And so, one of the worst things you could do is have a meal, just a big meal before you go to sleep. That's probably one of the worst things you could do because it doesn't allow. So, there's this thing called autophagy or autophagy, in which the cell basically clears itself out of damaged, misfolded, and foreign proteins. But if you, and the brain is very important in doing that when you're sleeping, but if you eat before you go to bed, you actually switch that process off. You eliminate or you reduce, sleep-induced autophagy or autophagy, which is very important for brain healing and brain recovery. So, it's just a matter of developing, simple lifestyle changes that can enhance your health. And they need to be simple, they're inexpensive, you can adapt it to your lifestyle. These are not difficult things to do. And obviously clearing out your pantry is important. If you just look what's in the pantry, if it's in a box or in a bag, has labels on it, it's probably not real food. You want to put it in the garbage can. Or I wouldn't even donate it to someone because that's really not fair.
Right.
I would just empty your pantry of things that do not look like food.
And one thing that we like to say is that if it doesn't rot, don't eat it. And in general, there's a lot of truth to that. I mean, there are ways that we preserved food for thousands of years with salt and stuff, but in general, if it doesn't rot, don't eat it. If bacteria and fungus won't grow on it, do you think it's going to be good for us? I mean,
Yeah.
seriously. So, yeah, real food. So, speaking of on the same topic, next week, Janet and I, we will be traveling to Arkansas. We're super excited to see Dr. Amy Beard and visit her. We're going to have a live podcast in Arkansas with her. And our topic is going to be, she's a functional medicine doctor. And our topic is going to be nature therapy and how important nature therapy is, getting outside and, enjoying nature. There are so many things that happen. And, with the sunlight, we all know about vitamin D, but it's so much more than that. I mean, there are neurotransmitters and hormones that are stimulated when we are outside. Most of the things we probably don't know what happens, but we just know that it's healthy for us.
Yeah,
So
actually, vitamin D is part of it, but there's something called photobiomodulation. So what you may not know is 40% of the sun's radiation is actually infrared light. And infrared light penetrates near infrared, about, 20 centimeters into the body. It actually has enormous physiological benefits in terms of proteins called heat shock proteins, in terms of directly activating mitochondria, in terms of healing. So, while vitamin D is important, that's the ultraviolet light, the infrared, which is part of the sun's brilliant radiation, is really important for healing, for promoting health. So that's something people don't really know.
that is that. Thank you for that. I'm not surprised, but I didn't know the detail of that. So that's awesome. Thank you for sharing that. So we do have a question. If you want to answer a question, and it's on hormones, and Janet and I specialize in hormones. So if you want to defer the question to me, you're welcome to.
Yeah, I can try. I'm not an endocrinologist.
Right. So Darcy Poland, thank you for your comment. She says, I hate to be taking thyroid and progesterone hormone daily. Is there hope to get off these? What can I do to get off these?
Yeah, so that's a little bit more of a complicated question. If a patient is hypothyroidic, there may be a number of reasons that is happening. So, what I would say is, first thing is adopt a healthy lifestyle. So, exercise, sunshine, and intermittent fasting, and good food. And then see what happens to your hormone levels. If you have a reversible problem, like I did. I was insulin resistant. My insulin resistance has dramatically improved. So if you go down this path, it may improve thyroid function, it may improve ovarian function. So you may become less dependent on these exogenous hormones. Obviously I would be careful. I wouldn't just stop them, because, that can cause, issues. But, the goal would be to adopt healthy lifestyle changes and then allow you to wean yourself off these medications. And, obviously you have to be careful what physician or practitioner you go and see, because most medical doctors are completely clueless. So you really need to see a physician that has an interest in, a more open approach. Who believes in, natural therapies, and is more open to holistic, medication. So one has to be realistic that there is a role for certain of these medications, but, we see patients taking 12, 16, 20 medications, which is completely absurd. So I think, the first thing is adopt a healthy lifestyle, get enough exercise, get enough sunshine, and then, see if you can, monitor your levels and see if you can get off these drugs.
I think that's a great answer, and I will echo that, but also add a little bit to it. Janet and I, we specialize in hormone replacement, so we deal with hormone patients all over the nation, and I have seen people that change their lifestyle. I'll specifically speak about men, younger men. When their testosterone should be optimal, and it's not, they change their lifestyle and they can raise their testosterone levels by 200 points. So you can do the same thing with many other hormones, whether it be thyroid or whether it be your ovarian hormones. Although as we age, our ovaries and our testes do just naturally decrease production of hormones. So as we get older, it is more difficult to optimize those levels without supplementing with hormones. Now, let's realize too that the hormones that she's talking about sounds like to me they are bioidentical hormones. So they're the same exact copy of hormones that we already have in our body. We just don't have enough of them. So a lot different than taking a pharmaceutical that has other type of effects in the body. So great question, Darcy. I hope we answered. If we didn't, please feel free to comment some more.
Yeah, one interesting fact people may not know is that when you do intermittent fasting, actually your human growth hormone levels go up, which is really important because, as we know, with aging, growth hormone goes down and it actually interferes with muscle mass and muscle bulk. So intermittent fasting, unlike any other form of dieting, so a regular diet will cause, whatever diet that is, the exercise more, eat less approach, growth hormone goes down. With intermittent fasting, actually, your growth hormone goes up, which is a very important finding.
Well, and when we think about it, that just makes sense. I mean, if you're constantly in a phase of too much energy, if you're eating all the time and you're storing all this fat, you don't want growth hormone, right? Your body says, I don't need growth hormone. I've got too much reserve already. So it's not a surprise that intermittent fasting would stimulate growth hormone. And of course, it makes insulin levels go down. And as you kind of mentioned, I think one of the biggest problems we have in our healthcare system, it's not high glucose even though I get it, that's how we measure diabetes. But there are many diabetics that have not been diagnosed yet because their glucose is not high enough, but their insulin levels are sky high. We had a guy on our podcast that he weighed over 700 pounds, and his insurance company would not pay for bariatric surgery because he didn't qualify for diabetes. His glucose wasn't high enough. I guarantee you, Dr. Marik, if you measured that guy's insulin, sky high.
Yeah, I mean, what you say is absolutely true. I mean, there is this long period of pre-diabetes where people are insulin resistant, have high insulin levels, but normal glucose. So that's really important. So I think you just need to assume if you're overweight, if you are a starch and glucose addict, that you're insulin resistant.
Right. And I'll say on the flip side too, that's why we can't use, I mean, big pharma and our medical system is really good about finding a number that we can treat, i.e. glucose. Okay, if your glucose is over 100, you're diabetic. Or if your cholesterol is over 200, you need a statin. We're really, really good at doing that because then we create drugs that people be on for the rest of their life. But I use myself as an example with the glucose one. My glucose runs about 110 on average. So a traditional, doctor that's not educated would say, well, you're pre-diabetic. You measure my insulin level, it's less than 3. I'm an endurance athlete, so I burn a lot of glucose. And I wore a continuous glucose monitor before. And, when I do my long 5-hour rides on a bike, my glucose averages 140. So, because I'm burning it. So you can't just look at one number and just treat a patient. But in medicine, that's what we do all the time. Oh, cholesterol's 201, you got to have a statin. Doesn't matter what your HDL is, doesn't matter what your triglycerides are. And in reality, those are, or your insulin, those are more important when it comes to metabolic health.
Yeah, absolutely. And I don't think we should be fixated by these blood tests. Do what makes common sense. And when it comes to cholesterol, the body makes cholesterol for a good reason. It needs it. There's an enormous amount of cholesterol in the brain, and you need it. So this obsession with getting your cholesterol down is completely misfounded. It's a pharmacological hoax.
I think that cholesterol thing is one of the biggest scams ever in medicine until what happened over the last 3 years. And if you follow the money on those drugs, cholesterol drugs were the biggest moneymaker ever until the last 3 years, and we got some other drugs that came out. So I mean, take that for what it is. And I think one of the good things that's happened over the last 3 years is people like yourself, people like me, even though I was already questioning stuff, um, and just run the mill lay people that aren't even in healthcare, they've started questioning a lot of these things that are going on in healthcare. That's a good thing.
Yeah. So, what you say is absolutely true. It's been a horrendous 3 years, but I think it has shone the light on something which was there all the time. The corruption, the lies, the deceit that's been propagated with regards to our health and well-being. So, if there is a silver lining, this is what it is. And, obviously for me, going on this journey is what exposed, the truth.
Right. So as we wrap this podcast up, Dr. Marik, tell us what you have a passion for.
That's a good question. I think I've developed a passion for knowledge and understanding and reading. I've become, I used to read medical texts and journals. I can't read them anymore. I'm really interested in, life and reading about life. And there's some really good books out there. So, and, knowledge is power. The more you know, the better decisions you can make. So, I think that, especially with the internet now, you have access to just so much information. You have to filter out what's good and what's bad, and, go on this journey of self-enlightenment.
That's right. So what's the best way to get a hold of you if somebody has any questions?
Yeah, probably through the FLCCC. You can go to the website, and we have a whole number of portals, and probably that would be the best way to get hold of me. We have people who monitor our emails, so if someone has a question, that's probably the best way of getting hold of me. And in addition, the website, we're not selling anything. We here to empower people, to provide knowledge, both practitioners and to lay public, the people. And so we have an enormous amount of information that's out there. Last night we did a really interesting webinar with Dr. McCullough on sauna and sunlight and photobiomodulation.
I saw that on there. You were just talking about that. That's awesome.
Yeah. So, something I would never, ever have dreamed of in my lifetime. So, that's the cool thing, is learning new things. An old dog can learn a new trick. And that's, what's so cool.
So we have Dr. McCullough come up on our podcast here in about a month or so in early December. So listeners and viewers, stay tuned for that. I'm super excited to have him on. One last question. I try to answer most questions on the line. So here's one. It's just kind of a comment from Darcy. I have seen positive changes with intermittent fasting and even lost some weight. I know I need to have a better diet. That's the hardest for me with a large family of teenagers who are pickier. I agree. One thing I will comment about that is, first of all, teenagers follow, or kids in general, they follow what their parents do. So if we start eating healthy, they will eat healthy. I have a personal health journey myself and change my family's health because of that. So, and it can get tougher, but it can be tough, but generally we're the role models and they will follow us. And of course she says, thank you so much. Much respect for you both. So it's always awesome to hear. So Dr. Marik, I really appreciate you. I appreciate everything you've done, including changing your own personal health journey, because that is inspiring to others to realize that it's possible to reverse a lot of these diseases and get off medication. So thank you for doing that. And let's please stay in touch.
Thank you. Thanks, kindly. And to Darcy, you know what? This must be a family event. Get involve the family, do what you can, try and teach your kids a healthy lifestyle, and I think it will pay dividends for them years ahead.
Yes, absolutely. So thank you, Dr. Marik. Stay tuned next week. I'm not sure what we have on Monday, but Monday at 12:30 to 1:30. As always, we will be streaming live Pacific Northwest Pacific Standard Time. Not sure of our subject, but next week, do not miss our Friday episode because we will be with Dr. Amy Baird in Arkansas on nature therapy. And we will just kind of continue this conversation about how to stay healthy. So, Dr. Marik, thank you for all you do. I really appreciate you. You've helped our goal of educating and empowering individuals to take charge of their own health. So thank you.
Sure. Thanks for all you do. It's
All right.
good to see you again. Thank you, hey.
Yep. Listeners and viewers, thank you for tuning in. I'm tuning in Monday, 12:30 to 1:30. Health Solutions with Shawn and Janet Needham. Thank you.